Over 32 years experience representing healthcare professionals. He's the founder of Chapman Law Group, a multi-state firm dedicated to health law and the representation of health professionals.
Thank you very much. I know you're here for CMEs, and that's always a great thing. That's why you want to be here on Saturday to listen to me talk. I highly doubt that. So, since I've represented doctors for so long, anytime you have a question, I don't care if it's about what I'm talking about, just ask me and we can talk about that. A lot of this stuff you've already gone through. I don't know that I'm going to teach you some things that are, earth-shattering to your practice. My hope is that I just keep you out of jail. Or allow you to stay practicing. And some of you chuckle, but understand this. We have 19 attorneys. The only thing we do is represent healthcare providers. We open 70 new files a month, all related to either criminal indictments of medical providers, licensing actions of medical providers, and a small portion of those, probably 20%, are other things, people that want to get involved in kinds of things. So that side of the business is very active. And part of the reason is this. I run across a lot of doctors, they didn't know they couldn't do it, particularly ones that came from other countries. They come here, they do things, and they say, well, we can do this at home, how come we can't do this here? And then they find themselves getting sentenced to 5 years in prison or 3 years in prison or something of this nature. So it could happen. I can't tell you the number of doctors that come into my office, actually cry. They have tears in their eyes because I didn't know I couldn't do that. It made perfect sense to me to do it. They're trying to help somebody. They're trying to do this and trying to do that. So, I was listening to a program on my way in talking about the building industry. And the person said it's the most regulated industry in the world. And I laughed. Because the most regulated industry in the world is the healthcare industry by far. It's not like 50 years ago when Marcus Welby was around, right? You could walk in, you could do everything, you could trade a chicken for doing this or doing that. Not anymore today. The rules are completely different. So we're going to go through a bunch of them. If I say things to you that help, that's great. If not, we can go into some other things. Let's talk about physician self-referral. You know it as the Stark Law, and you know it as the Florida Self-Referral Law. They're synonymous in a lot of ways. There are some differences. But here's the big thing to remember. It only applies to physicians. You're physicians, right? It also only applies when you're referring a Medicaid patient to a designated health service. So you say, well, okay, that's great. There might not be a lot of designated health services, and there's not. There's only 12 of them. But here's the problem. They're the big ones. DME equipment, designated health service. You refer somebody to a practice that's owned by you, owned by your wife, owned by your children, owned by your grandparents, you're in trouble. Your stepchildren, all those folks, you're in trouble if you do that. And they have even part ownership in it. You don't have to have total ownership. There's a whole bunch of exceptions to it. Now the good thing is, it's not criminal. You don't go to jail for it. The bad news is you can get a really hefty civil monetary penalty for doing it, which is 3 times the amount that Medicare paid, plus $11,000 a transaction, plus up to $250,000 just so you don't do it again. So these things can add up very, very, very quickly if you do violate them. So just be careful. We have a compliance division in our department, or in my law firm, and they're constantly asked questions from physicians that want to get in deals with their friends, they want to get in deals with their relatives because they see other people doing it, and that's their biggest thing. Well, Dr. Smith down the road, he's doing it. And I say, well, Dr. Smith could go to jail, or at least get fined in this case if he gets caught, so you can't do it. It's so complicated. Don't get into a business deal or refer patients to somebody that you have a relationship with unless you talk to a lawyer first. That's the best advice that I can give you today. Now, is it monitored a lot? No. But when you get caught, it can be very, very expensive because some of the things go on for years. You get a free space from a hospital. so that you can send patients to the hospital. They don't charge you fair market value. That's a stark violation. It can also be a kickback. Then we go to false claims. Now, false claims is a huge thing. It was a big 2016, the Supreme Court had a case called Escobar. Big case. It's actually the case that I wrote my graduate thesis on for my LLM degree on. And it's talked about implied certification and actual certification. Those might mean nothing to you except this. When you sign the order, when you electronically sign the UBO4, when you sign the Form 1500, you are certifying that you complied with every little rule that the government decides to come up with. Now, what Escobar did for you, it helped you, is by saying this. You only have to comply with the rules that are material. Now, that's a big deal because before that, there were cases, and I'll make this up. So let's say in order to charge for a radiology service, okay, you had to be, the room had to be painted pink. Your room was painted blue. And so you were taking and you were charging for radiology services. The government would come back and say, well, that's a false claim. Why? Because you didn't comply with one of the conditions preceding to filing a claim. Your room was blue. You had to be pink. And there's a lot of rules like that that are just that ridiculous. My personal theory is that the government, through the use of ACPHC guidelines, is trying to nationalize the entire standard of care. They're trying to say exactly what you have to do every time you see a patient. You guys and ladies know this. When you do, what is it, 90914, 913, 912, 915, this is what you have to do. You have to do this, you have to do this, you have to do this, and if you don't, you're going to get in trouble. I just settled a case in Arizona. These two doctors got together, built a huge practice in 10 years in an urgent care facility. Huge, really big. Thought they were doing everything right. Sold the practice for a lot of money. 3 years later, the government comes after them and says, you know what? 36% of your 99214 should have been 99213s. So we want $14 million back. We cut a deal and they paid them some money back and went out. Because it's hard to fight with them. So be careful of false claims. False claim is whether the procedure was not medically necessary or medically necessary. And then whether you followed the guidelines for Medicare, Medicaid, TRICARE, private insurance. This is the kicker right here. See this? Before a couple years ago, everybody thought false claims only applied to Medicare, Medicaid, TRICARE government programs. Well, it doesn't. It applies to Blue Cross Blue Shield and United Healthcare and any other healthcare program that you can come up with. And if they can't get you on a direct violation here, they'll get you on a conspiracy violation because they'll say you were working with a couple of your friends. So be careful. And I'm not jaded, just that I represent lots of doctors that unintentionally walked into these kinds of problems. And now you have the anti-kickback. Here's the only thing I need to tell you about the anti-kickback. Don't pay anybody anything for a referral. Nothing, nada. Don't give them a cup with your name on it. Don't give them tickets to the baseball game. Don't give them anything. There's an exception up to $350 a year, cumulative for a person, but that's like you can give a birthday gift or something like that. But don't fall into this kind of thing. Well, you're going to be hired to do teaching for the DME equipment company. You're going to go around and teach seminars at really nice restaurants where only 2 or 3 people show up, and you consume, champagne worth $1,000 or whatever, and you say, well, no, I wasn't paid for, this. I was paid for teaching, because the government sees right through that kind of stuff. Anything is a kickback. And frankly, because of other laws that were stemmed from this, it saved all of us. I used to have to spend about $30,000 a year Christmas time, sending gifts to insurance companies and this and that and this and that. And then the federal law changed along with this. Now I don't have to, because they can't accept gifts, which is great. Save me a lot of money. You don't have to do that. So be careful of a kickback. A kickback is anything of value. A free dinner is a kickback. Okay? And that's really simplistic. There's lots of other things that go along with it, but we got to move through a lot of things.